Good day everyone, I am Arvimi Lagari. We're here to introduce to you our Community Health Promotion Program entitled Workplace Stress Management Program together with my group mates Siti Maha Pasandalan, Lilita Maslog, Jumana Rizada, Briza May Antes, Rakiza Gaugay, Johanna Kamid, Farhana Jabu, Barbie Sangkuan, and Abdul Fatah Taha. Today, teaching is one of the most stressful occupations in the Philippines. High levels of stress are affecting teacher health and well-being, causing teacher burnout, lack of engagement, job dissatisfaction, poor performance, and some of the highest turnover rates ever. So, we decided to implement a program about stress management targeting the faculty members. Priority population, faculty members of San Isidro High School in Balabagan, Lanao del Sur. Rationale: stress is a prevalent problem in our society. Excessive stress affects health in very bad ways. According to the National Institute of Mental Health, over time continuous strain on your body from routine stress may lead to serious health problems such as heart disease, high blood pressure, diabetes, depression, anxiety disorder, and the other illnesses reported by Healthway 2012. Experiencing stressful life events such as divorce or job loss can reduce regions of the brain that regulate emotion and important psychological function in all individuals. This finding was reported by Yale researchers in a study found in the journal Biological Psychiatry. Needs Assessment. Step 1. Determining the purpose and scope of the needs assessment. So what is the goal of assessment needs? The goal of assessment needs is to determine the participant's stress level, knowledge about stress management, awareness of program of faculty members, and feelings about a health education program implementation to reduce overall stress. So, ang among goal judani is makahelp sa faculty members, also makaprovide pud sa ilang skills needed. What does the planning committee hope to gain from the needs assessment? So, dani is i-determine na mo unsa nga mga factors para makaprovide og alternative solution to minimize the stress. So, the planning committee is intended to actively take employees through a stress reduction techniques and reduce stress while on the workplace. He or she also intended to physically educate and introduce some techniques in the hopes to reduce perceived barriers and improve self-efficacy towards gaining skills for successful stress management. What kind of resources will be available to conduct the needs assessment? So, dali na may makakonduct ug magunahuna kung unsaon na mapaghandle. Like sa cost, sa time, ug unsa nga day para mahimo kani nga assessment. So, curriculum and other instructional resources like educational materials, available space for implementing the program, equipments like computer and chairs, supplies also needed to conduct the needs assessment like copy paper and yoga mats for the activities. So for that step 2, Miss Pasandalan, please proceed.
Gathering data. Identify the primary data necessary. So our primary data necessary is we're gonna collect through interview transcript and questionnaire survey, and that will be our primary data necessary to conduct and implement this program. So our secondary data necessary is other studies that support our program will be our secondary data that necessary to conduct the program. The success of other stress management program can help to speak for the success of this proposed plan. Many reports on stress management program will be conducted.
Step 3. Analyzing data. Informal analysis. The needs assessment data is quantitative and qualitative survey, determining the participants' stress levels, knowledge about stress management, awareness of programs, and feelings about a health education program implementation to reduce overall stress. Everyone experiences stress, and sometimes that stress can feel overwhelming. You may be at risk for an anxiety disorder if it feels like you can't manage the stress and if the symptoms of your stress interfere with your everyday life. Pero nadyo uban nga dili na jud ka-handle sa ilang stress na gibati. So mo tong nay magka-depression, magka-anxiety or magkasakit jud. So mo nang point sa among program is to give them awareness on how to handle the stress. Step 4, identifying the risk factors linked to the health problem. Internal factors which influence the ability to handle stress include nutritional status, overall health and fitness levels, emotional well-being, ability to control stress through relaxation techniques or other strategies, and the amount of sleep and rest we get. Many behaviors that increase in times of stress and maladaptive ways of coping with stress, like drugs, pain medicines, alcohol, smoking, and eating, actually worsen the stress and can make us more reactive to further stress. Risk factors for unmanageable stress include a lack of adequate social support.
Step 5. Identifying the program focus. Identifying the predisposing, enabling, and reinforcing factors that seem to have a direct impact on the targeted risk factors. A number of stress causes for teachers, including high job demands, pupil misbehavior, poor working conditions, poor relationships at work, role conflict, role ambiguity, lack of autonomy, poor school ethos, and lack of developmental opportunities. Encouragement by friends and family members and the positive feeling of the individual after controlling stress, deep breathing, and relaxation were considered reinforcing factors, and this increased after intervention in the case group. So, when teachers are highly stressed, also the student show lower level of both social adjustment and academic performance.
Step 6. Validating the prioritized needs. Who is the priority population? The target population that will participate in this program will be the faculty members of San Isidro High School who are interested in the program. What are the needs of priority population? Priority population need to know what stress is and its effects on health before they perceive stress as a health threat to them. The stress management program will provide a curriculum and disseminate education materials so that SIHS faculty members' knowledge base and awareness is expanded. Which subgroups within the priority population have the greatest need? Professional ranking, age, and length of teaching make a difference in level of faculty members. Occupational stress, but the most priority population have the greatest needs in administrative office of the head of the school because principals are facing emerging challenges never before seen in education, including the overwhelming effects of poverty, increasing pressures on student achievement, the breakdown of communities, lack of financial resources, and a host of other issues. Where are the subgroups located geographically? They are located at San Isidro High School at Balabagan, Lanao del Sur. What is currently being done to resolve identified needs? One of our groupmates said that every Saturday there are activities that the faculty members do at Balabagan Gym like Zumba dancing. What well have the identified needs been addressed in the past? Faculty members are take regular breaks, encourage them to exercise daily, take time for their friends or a significant other after work, pursue hobbies, listen to music, and take time off. They're assessing their stress level on their own way. What is the capacity of the community to deal with the needs? The community can deal with the needs in a way that they can give some breaks to the faculty members of SIHS. Let them use the gym building in Balabagan to do some activities for the relaxing day. What are the assets in a community on which a program can be built? Community can provide mental health services who can help the population reduce the risk of chronic disease related to stress, anxiety, and substance abuse. Most importantly, mental health services save lives while improving the outlook for people who may feel stressed.
So, and setting the appropriate goals and objectives of this program. So, the goal of our program is to provide stress awareness, education, and wide variety of tools for the faculty members of San Isidro High School to utilize for stress in their lives. So, first goal is to increase coping skills of the faculty members of the San Isidro High School, and second goal is to reduce perceived levels of stress of the faculty members of San Isidro High School. In this program that we propose, we have 4 objectives. So first, by the end of the program planner will have distribute informational pamphlet on coping skills for faculty members of San Isidro High School. Second, prior to the start of the program planner, which is us, will deliver the program description to all participants interested in the program. And thirdly, by the end of the program, the health educator will have distribute informational pamphlet on stress reduction techniques for faculty members of San Isidro High School. And lastly, during the program, interested employees will participate in at least 2 stress management discussion during lunchtime.
Hello everyone, my name is Joanna. In this slide, I will discuss about intervention, which indicate multiplicity and dose. So, we will conduct a whole day session to raise stress awareness and provide a number of techniques for SIHS faculty members to use in their daily lives. This program helps identify triggers of stress while collaboratively developing a plan to manage them. So to make this session possible, we'll invite a registered psychiatrist as a guest speaker because they are better knowledgeable in this sector and are frequently asked by or frequently contacted by people suffering from medical problems related to stress. The program planner will distribute the program description to all employees who are interested in participating in the program. So during the program, interested employees will take part in at least 2 lunchtime stress management conversation, or we can call this a counseling. So lastly, the completion of the session, the program planner will have given coping skills informational pamphlets to SIHS personnel or faculty members.
What needs to change? The target population should make a to-do list daily, prioritize the acts in the list, and plan the acts accordingly. Take regular breaks during work to relax them by effective time management. The employees can achieve their targets timely and can meet work pressures and thus avoid stress. Do hard work. So this means that the faculty members who are experiencing of having a stress should also make his or her plan for themselves by managing their time to avoid stress.
So where is change needed? So the change is needed for the faculty members. They must undergo modification in order to be emotionally and physically fit so they can provide a high quality education to their students.
At what level of prevention will the program be aimed? Primary prevention, these methods will be proactive actions that will be taken by the program planner that aim to prevent illness among faculty members by reducing stress exposure. This is the best way to reduce job stress and the illnesses that workplace stress and should be top priority. So it means that in primary prevention, the program planner will prepare something like kanang mag-set na og goals, preparing og mag-set pud og planner so para enable to prevent stress exposure. So in second prevention, in this program aim to modify and target population response to stressors. We often include providing training and education to employees on stress management to assist employees in coping with residual stress in environment and reducing its harmful effects. So in secondary, this time we will be able to take action to assess those employees to attend programs such as training and education to those particular members who undergo in stress. So in tertiary prevention or reactive and aim to minimize the effects of stress related problems once they have already occurred. So this means that we will help the employees for their recovery.
What level of influence will the intervention be focused? The level of influence of the workplace stress management program will be on the interpersonal level, using both the health communication strategy and health education strategy. Both will be used to increase awareness, educate, and influence the priority population to move them toward change regarding reducing and coping with daily stress. During and after the program has finished, several objectives will be evaluated in order to determine whether or not objectives and goals have been met.
The population for pilot testing, implementation of stress management programs for all the faculty members who undergo overwhelmed stress in San Isidro High School at their workplace. So it means i-implement na mo ang programs para sa faculty members for managing their stress in San Isidro High School.
For the evaluation for this program, we have the standard acceptability. So staging has been considered a high-stress job for a year. Community should be aware that this need must be addressed. Volunteer for a cause. Seek out opportunities to make a difference in the community. Working together toward a common goal helps instill solidarity. Taking action might also help stressed people feel less anxiety. Educate yourself and learn about communities that might come under threat or are already vulnerable. The community should have some programs that regards to this matter for the good of its people.
Criteria based on outcome evaluation. After the completion of the program, half of the participants who use coping skills of stress with reducing mechanism will show a 30% better and the composition in the workplace after the completion of the program. Half of the employees who used copying from the program will reduce their program will report a reduced and a perceived stress. Those who do not participate. Among of the those did not participate.
For the criteria based on impact evaluation, so after the completion of the program, half of the participants will be able to identify 2 coping techniques. Weeks after completion of the program, at least half of interested participants will have employed coping techniques to help reduce stress. And during the program, some of the participants will be able to explain one stress reduction technique. After the program, at least half of the participants will be able to identify at least 2 disease risks related to high stress levels. Most importantly for this program are the stakeholders of the program. So we have the program planners, which is the group 6 members, which is us, and the faculty members, which is our priority population, which is the faculty members of San Isidro High School, and of course the mental health service like the registered psychiatrist and our speakers, the speaker of the program, and the school campus officers. And we need the help of school campus officers to make the program possible. And of course, the people who will be part of the program. And that will be all. Thank you for listening.